classification of cataract, that we classify the cataracts when we have different morphologies, like when you have opacity at the capsule and so on. Okay, you name it accordingly. So the first question from this slide, Hanji, I'm repeating. Dr. Modi, I'm repeating. Today we have the class till almost 4:45. Okay? Till evening we have the class. So I make sure that you prepare everything what we have read today in your evening spare time. Okay, Dr. Akshata, I'm sure when you back tomorrow, you will be done with everything what we have read today. Okay? Chalo. Yes, Dr. Modi, for you, I'm repeating, please see. I told you that posterior subcapsular cataract is the most visually disturbing cataract. मैं आपको थोड़ा सा हिंदी में भी समझाती हूँ. देखो, अगर एक आंख से आपको कुछ नहीं दिख रहा, डेफिनेटली वो दिक्कत करेगी. You are not able to see anything. But अगर आपको इससे दिख रहा है, but still आपको रोशनी में बहुत ज़्यादा चौंध पड़ रहा है, don't you think this will be more visually troublesome, isn't it? So why there is a phenomenon of glare? Glare is because of the scattering of light. Now, when you go in sunlight, pupil becomes very small. So when your pupil constricts, सिर्फ एक या दो लाइट रेज जा पाती हैं, क्योंकि प्यूपिल छोटा हो गया है बच्चे, है ना. तो वहां से क्या होगा, जब लाइट रेज ऐसे जा रही है तो ये डायरेक्टली इस ओपेसिटी पे स्ट्राइक करी. सपोज द ओपेसिटी इज हियर, will it be striked by the opacity? No. But if the opacity is right here in the posterior subcapsular region, the light ray will definitely be striking it. And because of that striking, there will be an irregular scattering of light. And because of that scattering, you will have a glare. अब समझ में आया डॉक्टर मोदी? बता बच्चे. पोलर में भी सी डॉक्टर ऐश्वर्या, अगर पोस्टीरियर पोलर है ये तब भी होता है, लेकिन सब कैप्सुलर में ये ज्यादा होता है. क्यों? बताती हूँ क्यों. सो वी हैव अ नोडल पॉइंट ऑफ आई. नोडल पॉइंट ऑफ आई होता है जहां पे सारे लाइट रेज आके कन्वर्ज होता है. बहुत ज्यादा फिजिक्स में नहीं जाना. Dr. Prakash, I have already told this in English many times, है ना? That's why somebody who has not understood, I have explained again in Hindi. Otherwise, I'm taking all precautions that I don't miss saying something in English. ठीक है? You have not missed anything. Don't be in doubt. You're not missing anything. So this glare will happen in posterior polar also, but it is most common with posterior subcapsular. Why? Because there is a nodal point of the eye, and at that nodal point of the eye, all the light rays converge before they go on to the retina. Now this nodal point of the eye is very near the posterior subcapsular cataract. That is why the light rays converge here, and when they are getting converged, because of this opacity, they will undergo scattering. Okay, so it's not wrong, it will be there in posterior polar region also, but mostly it is with subcapsular. Okay? Chalo. Now the second thing which we have to learn from this slide, second thing, it is the complication. So it is the posterior polar cataract. It is the posterior polar type of cataract which is associated with most complications during surgery. Most complications during surgery. Now what happens, guys? When you are doing a cataract surgery, it is the posterior polar cataract which gives a lot of challenge to the surgeons. Why? Let me show you with the example. Please see. Suppose the opacity is right there at the posterior pole, and you know the posterior pole is already a weak region for the capsule, है ना? Capsule already वहाँ पे बहुत ही पतला है, वहाँ thin है, तो क्या होगा? When you do a surgery, the capsule is likely to get rupture, isn't it? What is the complication? The complication is rupture of the posterior capsule. ठीक है ना? Already the capsule is very thin, so it's likely to get ruptured. Now, if the capsule gets ruptured, what will happen to the nucleus, guys? What will happen to the nucleus? Won't it be dropping down? It will drop down. Okay? So this is the complication, rupture of the posterior capsule, and this is the complication which is called as a drop of the nucleus. Nucleus drop हो जाता है. There's a drop of the nucleus into the vitreous. Okay? ठीक है, everyone? So posterior polar cataract is associated with two complications, and most of the time you land up in a complication. There's a rupture of the posterior capsule because it's already a thin area. When the capsule gets ruptured, the nucleus from the center, it will drop into the vitreous cavity. Okay, these are the complications. Please remember these two questions. Now, an expected question. So this posterior polar cataract has an appearance, very striking appearance, which is called as a onion peel appearance. ठीक है? This is your onion peel appearance. मेरे को कैसे पता चलेगा? How will I know whether it's a posterior polar cataract or a cortical cataract or a nuclear cataract? How will I know? It is by the look. When I see the patient on slit lamp, it is basically the look of the cataract, look of the opacity. So you see a onion peel appearance. Okay? Onion peel appearance. So simply they can ask you onion peel appearance is for which type of cataract? So it is for a posterior polar type of cataract. Everyone agree? Everyone understood? Okay, बच्चे? So two things we should know here. I'll show you a picture also. In a short while, I'll show you a picture. Okay? Hanji, please all of you see. So this is the topic which we have read. PSC is what? A posterior subcapsular cataract, which is visually most disturbing, and this is typically your onion peel appearance. आप देख रहे हो ये कौन सी picture है बेटा? It is a slit lamp picture. I am looking at the eye with the help of a slit lamp. So what I have done to the pupil? Pupil is dilated. Why I have dilated the pupil? Because I want to see the lens. And can you see? This is your clear area. This is all your clear area. The central opacity has the appearance of an onion peel. All of you can see that, guys. So this is your posterior polar cataract, typically posterior polar. ठीक है? हाँ जी, मैं एक बार ये न्यूक्लियस ड्रॉ पर बताती हूँ. देखो बेटा, डॉक्टर दीपू आप देखो एक बार. सो ये लेंस है बच्चे आपका, है ना? लेंस में न्यूक्लियस है, सेंट्रल न्यूक्लियस. वी ऑल हैव अ न्यूक्लियस. यस. Suppose if we have a rupture of the posterior capsule. Rupture of, so what will happen to the central nucleus? The nucleus will drop down into the vitreous cavity. Yes or no? है ना? This is your drop of the nucleus. So this nucleus will drop into the vitreous cavity, and that's a big problem. Your nucleus goes into the vitreous. Okay? This is a complication, and this is your posterior polar cataract. It's a peel of an onion peel appearance. Okay, beta? ठीक है? डॉक्टर वाघेला, इज इट ओके? चलो आगे बढ़ते हैं. नाउ हियर कम्स द मोस्ट इंपॉर्टेंट टॉपिक फॉर लेंस. दिस इज योर मॉर्फोलॉजिकल क्लासिफिकेशन ऑफ द कैटरैक्ट. ठीक है? नाउ वी आर गोइंग टू रीड द मोस्ट इंपॉर्टेंट टॉपिक इन लेंस एंड कैटरैक्ट. इट इज योर मॉर्फोलॉजिकल क्लासिफिकेशन ऑफ कैटरैक्ट. चलो ये पढ़ते हैं बच्चे आज. सो मॉर्फोलॉजिकल मीन्स व्हाट? So sometimes when I look at a particular type of cataract, I come to know what is the etiology. समझ आ रहा है? When I see a particular cataract, I come to know that this type of cataract is because of diabetes. Yes or no? So I look at the lens. It looks like as if snow is scattered anywhere. ऐसा लगता है कि snow बिखरी हुई है, white like snow. So it is typically seen in diabetics. ठीक है? Now diabetics, what type of diabetics? Type 1 or type 2 or both? Yes. So not 1 and not 2, but it is in both. But definitely type 1 is more specific. ठीक है? You can see in both, but type 1 is more specific. Okay, question number 1 and 2. Now, guys, please understand why we develop snowflake cataract. It's a very, very important topic. Very important. Please see. So when you have normal glucose, जो आपका normal glucose है, how is it metabolized? So it is metabolized by hexokinase enzyme. Yes or no? But when you have excessive glucose, like in cases of diabetes, this extra glucose is not utilized by hexokinase. Hexokinase कहता है मैं थक गया, मैं और काम नहीं कर रहा है. I'm not going to do more work, I'm tired. So it goes off, and what comes next? The next savior, है ना? Is your aldose reductase enzyme. ठीक है? So aldose reductase enzyme आता है आपकी जान बचाने. It comes to save you, and it utilizes the extra glucose into what? It converts the extra glucose into sorbitol. ठीक है? So lens में क्या जमा हो रहा है? What is accumulated in lens? An alcohol. All is an alcohol. So sorbitol accumulates in lens. Okay? So what happens when an alcohol gets accumulated? Listen to me very carefully. So normally there are proteins and water in the lens, but when an alcohol gets accumulated, the osmotic pressure rises. Because of that, it imbibes more water. Normally it was 65%, but when sorbitol comes in, it imbibes more water. So you have increased water content. So when the water content increases, what will happen to the transparency? The transparency goes down. ठीक है? So lens loses its transparency and becomes cataractous. I hope this point is clear to all of you. How snowflake cataract develops? So please don't say that in snowflake cataract glucose gets accumulated. It's never the glucose. It is basically the sorbitol. ठीक है बच्चे? Everyone clear? There are 4 questions here. The next type of metabolic cataract, or you can say morphological type of cataract, is an oil droplet cataract. Now question number 1 here is that it is seen in another metabolic disorder, which is galactosemia. Galactosemia, very good Dr. Madhavi, it is in galactosemia, wonderful. Now the same things are happening here, same things. What is that thing? When you have excessive galactose, it fails to metabolize, and this excessive galactose is again metabolized by aldose reductase. अब क्या होगा? So this time excessive galactose will be converted into something else, and this is your galactitol. And galactitol is again an alcohol. Yes or no? It's again an alcohol. So what will happen? It's again an alcohol. So it will accumulate in the lens and it will imbibe more water. When it imbibes more water, lens will lose its transparency. The same thing happens. Okay? This will accumulate in lens. The same thing is happening. Okay? So what you have to learn here is that oil droplet cataract is the only reversible type of cataract. Otherwise, cataractous changes once occur, they cannot get reversed. But if at all you have galactosemia and you develop a cataract, if you completely eliminate galactose from the diet, these changes can be reversed. Okay? Oil droplet cataract. Now what about the third one? Next is your sunflower cataract. Very very important guys. Sunflower cataract किसमें मिलता है ये सबको पता होगा. Where do you see sunflower cataract? Anyone? Where do you see sunflower cataract? So it is not only in Wilson's disease, but it is also in chalcosis. ये chalcosis क्या होता है? What is chalcosis? It is systemic accumulation of copper in the body. ठीक है? आपकी बॉडी में कॉपर एक्यूमुलेट हो रहा है. एंड कैसे हो सकता है? इट कैन बी एन ऑक्यूपेशनल हैजार्ड. यस और नो? इट कैन बी एन ऑक्यूपेशनल हैजार्ड. ठीक है? So you have a sunflower cataract, and sunflower cataract, sometimes we also call this a pseudo cataract. Can anybody tell me why a pseudo cataract, friends? Why a pseudo cataract? Why a pseudo? Pseudo cataract means that vision remains almost normal. So if vision remains normal, we call it a pseudo cataract. ठीक है? ये clear है ना सबको? So not only Wilson disease, but you also see this in chalcosis. Guys, Dr. Kajal, Madhvi, Dr. Anu, Dr. Kaur, listen to me very carefully. You know Wilson's disease, that is your old knowledge. But what is the motive of the class? That you should know what is new, what you do not know, है ना? And you keep on revising what you already know. ठीक है? So अब next time कभी मैं पूछूंगी तो फिर से Wilson's disease alone नहीं बोलना है. You should always say the new thing what you have learned today, chalcosis. Okay? अच्छा ये बताओ, what else do you see in Wilson's disease in eye? What ring do you see? Yes. So you also see a Kayser-Fleischer ring. Very good. Good. So we'll talk about KF ring in detail in cornea. ठीक है? हम KF ring के बारे में अभी पढ़ लेते हैं. चलो छोड़ो. ठीक है? So Wilson's disease also will have a KF ring. K is a fresher ring. So you all know that, but there are some things about KF ring you should all know. Now this is typically a deposition of copper. Where? Copper in the Descemet's membrane of the cornea. ठीक है बच्चे? कहाँ होता है ये? Copper में एक layer होती है Descemet's membrane. There is a layer in the cornea, Descemet's membrane, and there you have copper accumulation. Okay. Now, and where exactly hole throughout the Descemet's? No, at the limbus. It is mainly at the limbus. Now, when it starts always in the upper and lower part. Later, it comes as a ring. ठीक है, जब ये start होता है तो ये ऐसे upper and lower part में होता है, and later on you would see a complete ring is being formed. Okay, guys, it starts as the upper and lower part. Now, do you think the vision is decreased with the ring? What happens to the vision with ring? Vision remains normal or vision is less? Tell me. Does it interfere with vision, guys? Absolutely no. The vision remains normal because the ring is in the periphery, right? Now, what about the reversibility? Once the ring is here, can it go back? Yes, it is a reversible ring. Okay? If you treat the Wilson's patient, this disease will be reversed. Okay? Now, guys, you know, you have a hepatic involvement and you have a neural involvement in Wilson's disease. Yes or no? You have a hepatolenticular degeneration, है ना? So when you have a hepatic involvement alone, समझ में आ रहा है? अगर सिर्फ लिवर में परेशानी है किसी पेशेंट को, there are only 50% chance of KF ring positivity. ठीक है? Only 50% chance. So this is not exclusive for Wilson's disease. Are you able to get my point? मैं कह रही हूँ कि अगर किसी को सिर्फ हेपाटिक इन्वॉल्वमेंट है तो उसमें 50% पेशेंट्स को ही केएफ रिंग होगी. ओके, बट इफ समबडी हैज अ न्यूरल इन्वॉल्वमेंट, he has a 95% of chance of getting this KF ring. Now am I clear? Am I now clear? So if the patient has a hepatic involvement, only 50% of patients will have a KF ring. If you have 100 patients with neural involvement, 95% of them will have a KF ring. Now is it clear, Dr. Murthy? Dr. Murthy RD? So please remember, KF ring can be a very important topic. Very important topic, because to your PG friends, this topic has been asked several times recently. So you can get the question, something on KF ring. Okay? Either they'll ask you to identify a picture question or a problem based question or something about these points. What is false? What is true? Okay, we'll do questions, you'll come to know. So this is all about your KF ring and Wilson's. Now let's see the fourth one. We are still on the morphological types of cataract. So the fourth one is a shield cataract. Shield. Shield cataract is seen typically with skin disorders like atopic dermatitis. Like atopic dermatitis. Okay? Skin disorders, atopic dermatitis. It's like a shield. Something like a shield. The next one is a next one is a Christmas tree cataract. Where do you see Christmas tree cataract? It's like needle-shaped opacities. Needle-shaped opacities. Yes, in myotonic dystrophy. Myotonic dystrophy. Myotonic dystrophy. The next one is very important as a picture question, a rosette-shaped cataract. It's a picture question also. Yes. Specifically, which trauma, beta? It is blunt trauma. Very good, Dr. Imam. Good. Specifically in a blunt trauma. Blunt trauma means mainly a fist injury. Blunt. Beware of those fist injuries, guys. Beware. Okay? The next one is special expected question, polychromatic lustre. So friends, what do you understand by the word poly? Poly means multiple, chrome means color. So when you see multiple colors in a lens, if this is your lens and you see multiple colors, ठीक है, आपको green दिख रहा है, yellow दिख रहा है, red दिख रहा है. So when you see multiple colors, you'll think about a Complicated cataract. Very important question. What's that? And I'm coming to that again. I'm coming to that again. So, Dr. Ishwarya, polychromatic lustre means you see multiple colors in a patient in the lens. Suppose there's a patient who's coming to you and he has, when you see under slit lamp, you see multiple colors. That means he has a complicated cataract. Now, what do you understand by the word complicated? Complicated here does not mean that it's a complicated case and I'm not going to operate. But this is a cataract which occurs secondary to other ocular problems. Understand now? So suppose a patient has uveitis, suppose a patient has glaucoma, and because of glaucoma or uveitis he develops a cataract. You will call that cataract to be a complicated cataract. Now you understood? So a cataract which has developed because of some other problem in the eye, not in the body. Diabetic cataract is not a complicated cataract. Snowflake cataract is not a complicated cataract. It's because of a systemic problem, diabetes. But a cataract which is because of ocular cause is complicated cataract. Okay? What do you see in complicated cataract? You see a polychromatic lustre. Now, few things more about complicated cataract. 2021, you had a question related to this topic. Hai na? Please see. Now, this is mainly after uveitis, after angle closure glaucoma. Please write down. After angle closure glaucoma, after retinitis pigmentosa, and after tumors of the eye. After tumors of the eyeball. Okay, friends. So there are so many causes after which you can develop a cataract, and this cataract will be called as a complicated cataract. समझ आ रहा है? ठीक है? Now, most of the times you see a polychromatic lustre, but you can also see a breadcrumb appearance. A breadcrumb appearance can also be seen. Okay, you can also see a appearance which is like crumb of a bread. Sometimes these cataracts are also PSCs. What is PSC? Posterior subcapsular cataract. Are you able to understand, friends? So suppose there's a young patient, like a 30-year-old patient who has a history of uveitis, inflammation of uvea. So he has come to you for a routine checkup and you see multiple colors. Then you ask about previous history. Then he'll tell you that he may have uveitis spelling. समझ आ रहा है? Mostly you will see PSCs here. Sometimes you can also have breadcrumb appearance. Yes, a pathological myopia can also cause that. Not a normal myopia, but a pathological myopia. Very good. A pathological myopia can also. Shubham Mehra, PSC. Bache, what is PSC? A posterior subcapsular cataract. So it's a very important short form. You must know. Posterior subcapsular cataract. ठीक है बेटा? Dr. Shubham, okay? Posterior subcapsular cataract. ठीक है बेटा? Dr. Imad, not all myopias, but only a pathological myopia. ठीक है, pathological myopia क्या होता है मैं बाद में बताऊंगी आपको. Okay. Now here comes a very very important question. अब आप मुझे बताओ ये पेशेंट क्या कंप्लेन लेके आएगा? What will be the complaint? हाँ जी, Dr. Shubham, what will be the complaint here? If he has a PSC, what can be the complaint? Complaint of glare. Correct? He will say my vision is almost okay, but I have a problem of glare. That when I go out in sunlight, I'm completely blind. There's a glare. Okay? Chalo, next. Now here angle closure glaucoma, please write down the cataract which occurs after angle closure as glaucoma flecken. Please write down what is glaucoma flecken. The cataract which occurs after glaucoma has been given a separate name, glaucoma flecken. ठीक है? Hanji, night glare. Glare in the night will be more by macular problems like ARMD. ठीक है? That is also glare, but that is glare during night, and it is mainly because of the macular pathologies, retinal problems mainly. Okay? Yeah, no need to thank me. I'm here for this only. है ना? आप अपने questions पूछ लो, whatever your queries are, and make good notes. Okay. So what is glaucoma flecken? Again, glaucoma flecken is a cataract which occurs after angle closure glaucoma. We have given it a separate name. ठीक है बच्चे? ये posterior नहीं होता है. चलो, so let's come back to this poly again. 1 minute का फटाफट quick revision. Polychromatic lustre, breadcrumb appearance, posterior subcapsular, complicated cataract. ठीक है? Most common causes uveitis, followed by your retinal problems like retinitis pigmentosa, pathological myopia. You may have tumors, and then you may have a glaucoma flecken. You may have a problem related to glare. Okay, please remember this much. It's very, very important question. चलें आगे. So now I'll be showing you few pictures. Guys, have a look everyone. सभी लोग इसको देखिए. So this is typically your snowflake cataract. You can see, दिख रहा है आपको? This is the dilated pupil. We have dilated because we want to see the lens. If we don't dilate, we won't see the lens. Okay, these are all slit lamp pictures. This is your diabetic cataract. Now here comes the snowflake, sunflower cataract. The opacity is in the form of a flower, isn't it? We call it a sunflower cataract. What else do you see in this? You also can have a copper deposition in Descemet's membrane, and this is typically your KF ring. ये सब brown दिख रहा है? This brown ring is your KF ring, guys. Okay? Typically a brown copper accumulation in your Descemet's membrane. ठीक है? This is in periphery, doesn't interfere with the vision. Now, can you answer this question, friends? Can you answer this question? All of you try to answer. Yes, D is not the correct answer, बेटा. See, मैंने क्या बताया था? ये sunflower cataract होता है, but pathognomic नहीं है, because it can also be seen in chalcosis. So how can that be pathognomic? Isn't it? And in Wilson's disease, you are not, it's not that you always get a sunflower cataract. ठीक है? It's not always that you get a KF ring. So these things are not pathognomic. Okay, guys, those who have answered D option, is that clear to all of you? Dr. Gargi and Dr. Rahul, बच्चे clear है ये चीज, है ना? So it is not pathognomic. It can be seen, but it's not pathognomic because you have chalcosis also where this disorder is seen. तो pathognomic कैसे हो गया? Okay बेटा, चलो बच्चे C तो बिल्कुल भी नहीं है. Dr. Alex, C is not, because it's not in the Bowman's membrane, it is in the Descemet's membrane. Dr. Alex, is it clear? So this is not a picture question, but you must know that this is how an oil droplet cataract looks like. It appears as if the drop of oil is there in the lens. Drop of oil. Okay, it's a reversible cataract. Now this is a picture question, friends. See, this is called as a rosette shaped cataract. Okay, it's a rosette shaped cataract. Now have a look here. This is a polychromatic lustre. You see, there's orange, there's a green here, there's a yellow here. So you see multiple colors. This is your polychromatic lustre, famous of complicated cataract. ठीक है ना? चलो, any problem till this point? हाँ जी, any problems, guys? Anything? चलें आगे? चलो. Okay, friends. So now let us talk about some symptoms of a cataract and what are the stages of cataract. Okay, let's talk about the stages of cataract. How the cataract progresses. We are mainly talking about the stages of the cortical cataract. Stages of the cortical cataract. So friends, Wilms tumor? No, Dr. Sudeep, it's not pathognomic for either. It's not pathognomic for either. चार चाल को भाई दो चीजों में है तो पैथोग्नोमिक कैसे हो गया, है ना? अगर ये एक ही चीज में होता तो पैथोग्नोमिक होता है ना. सी, जैसे रेटिनोब्लास्टोमा में कैल्सिफिकेशन इज पैथोग्नोमिक, और कोई ट्यूमर नहीं है आंख का जिसमें कैल्सिफिकेशन हो, सो इट इज पैथोग्नोमिक. नाउ अंडरस्टूड? ओके. Wilms tumor involvement is, I didn't get your question, beta. I didn't get your question, Dr. Shubham. बेटे विल्म्स ट्यूमर तो कौन सा ट्यूमर कह रहे हो आप? आर यू टॉकिंग अबाउट विल्सन्स डिजीज, डॉक्टर सैनी शुभम? आर यू टॉकिंग अबाउट विल्सन्स डिजीज? This was the rosette cataract. Okay, Dr. Ishwarya? Dr. Shubham, it was Wilson's disease. I told you in Wilson's disease, न्यूरल इन्वॉल्वमेंट, मतलब कि नर्व्स. अच्छा मैं समझाती हूँ, सुनो. Hepatolenticular degeneration is your Wilson's disease. You may have a hepatic involvement purely, you may have a neural involvement purely, or you can have both. अगर हेपैटिक इन्वॉल्वमेंट है तो 50% लोगों में ही आपको सनफ्लावर कैटरेक्ट केएफ रिंग दिखती है. अगर न्यूरल इन्वॉल्वमेंट है तो चांसेस ज्यादा है. देयर इज नथिंग अबाउट पेरिफेरल और सेंट्रल बेटा. ओके, कंफ्यूज हो गए हो? हाँ, आप कंफ्यूज हो रहे हो अब, ठीक है. सेंट्रल कुछ भी नहीं है, पेरिफेरल केएफ रिंग की बात हो रही है. ओके, केएफ रिंग की बात हो रही है. मैं कह रही हूँ अगर न्यूरल इन्वॉल्वमेंट है तो 95% लोगों में केएफ रिंग होने के चांस होते हैं. ओके, चलो ठीक है. अब हम बात करते हैं स्टेजेस ऑफ कॉर्टिकल कैटरेक्ट की. वी विल टॉक अबाउट द स्टेजेस ऑफ कॉर्टिकल कैटरेक्ट. नाउ फ्रेंड्स, normally you can't see my lens fibers. Why? Because my lens fibers are transparent, so even I cannot see your lens fibers. But when the lens fibers become visible, we call it first stage, where there is a stage of lamellar separation. There is a stage of lamellar separation. There is a stage of lamellar separation, and there is a stage of incipient cataract. It's an early cataract. ठीक है? It's an early cataract when your lens fibers become visible. Slightly you can see the lens fibers. Otherwise you can't see the lens fibers. Yes or no? Lens fibers starts becoming visible. This is your early stage. Stage of lamellar separation or incipient. The second stage is important. It is immature senile cataract. Immature senile cataract, that is your next stage. ठीक है? Immature senile cataract, your next stage. ठीक है बच्चे? अब क्या होता है immature stage में? क्या होता है? Few lens fibers. It's a immature lens. So few lens fibers are now opaque. That means only few are opaque. Few are still clear. Few lens fibers are opaque. Okay, that means some of the lens fibers are now opaque, some are still clear. Next is the MSC. What will happen in mature senile cataract? So in mature stage, all the lens fibers are now opaque. Okay? Earlier they were few, and now all the lens fibers are opaque. All the fibers are now opaque. There's no clear area in the lens. All the lens fibers have become opaque. Now what is HMSC? Hypermature senile cataract. Hypermature senile cataract. So what is the problem in hypermature, guys? Hypermature senile cataract can be further divided into two types. The first is called as the hypermature Morganian cataract, And the second one is called as the hypermature sclerotic type of cataract. ठीक है, Morganian and sclerotic ये दो तरीके के होते हैं. Now my first question to all of you: how will you come to know whether your cataract is mature, immature or hypermature? हाँ जी, how can you tell me? Answer me the question. बताओ. How will you able to tell whether it's a mature? हाँ, opacity is mature or immature or hypermature. डॉक्टर रौनक कैसे पता चलेगा बेटा? फाइबर को कैसे देखोगे? हाउ विल यू सी द फाइबर्स? डॉक्टर इमाद, not necessarily. Yes, Dr. Aishwarya is absolutely right. You will see the patient under slit lamp. Dilate the pupil, see the patient under slit lamp. If your lens fibers are all mature, you will say it is a mature cataract. ठीक है? Now very important is the color of the lens. Color. So in immature, please write down, immature, it is the gray white color of the lens, gray white. In mature, it is pearly white, white like that of a pearl. And in hypermature, it becomes milky white. Okay? Please remember these three: gray white, pearly white and white like that of a milk. तो आप सोचोगे मैडम ये white तो white ही है, what is this gray white, pearly white and milky white? But yes, these are the differences. Okay guys? Understood? Dr. Sai Gautam. Dr. Sai Gautam. Okay. What about the spread, beta? What do you want to tell me about the spread? What is your doubt here? Spread means you want to say the affected areas, बच्चे? है ना? I think you want to say the affected areas. Yes, definitely the affected areas, but it is mainly checked under slit lamp. Okay guys, previous slide is this one. ये देखना है. Dr. Akshata, this one, lamellar. Chalo, now let's talk about the hypermature. So guys, what do we understand by the word hypermature? Here, your lens is totally opacified, but this time the capsule show the changes. Okay, and because the changes are now occurring in capsule, there will be some complications. Okay, so please write down. Morganian cataract is associated with the complications which is called as a phacolytic glaucoma, and sclerotic cataract is associated with the complication which is called as a phacotopic glaucoma. Okay? These are the complications which occur. Yes, it's because of the subluxation of the lens. I'll explain you what happens. Please write down first. Phacolytic glaucoma and phacotopic glaucoma. Okay? These are two complications. Now, why phacotopic glaucoma occurs? Let me explain you. Why phacotopic glaucoma occurs? Let me just explain you. Written, everybody? Now, let us see what happens in sclerotic cataract. ठीक है, देखिए बच्चे. So this is a total mature senile cataract. Whole of your lens fibers are mature, but now this is a HMSC. So what will happen? There will be a change in the capsule also. I told you there's a change in the capsule. So this time your capsule becomes shrunken. Your capsule is now shrunken. Okay? So when your capsule gets shrink, what will happen to the zonules which were earlier taut and tight? Your zonules will become lax. Isn't it? Your zonules will become lax. So if your zonules are lax, will they be able to support the lens? Yes or no? Will they be able to support the lens? Tell me. No, they will not be able to support the lens. If they are not supporting the lens, what will happen to the position? The position will go here and there. And this complication is called as subluxation of the lens. Okay? Your lens will not be in its normal place. It will go here or there. It will either go to the posterior segment or it will come into the anterior chamber. And because of this subluxation or dislocation of lens, there is a glaucoma. What is that term? This glaucoma is called as the phacotopic glaucoma. The word topic means position. Is it clear to everyone? Dr. Modi, if you do a cataract surgery, you are basically taking out the lens. Lens contributes to plus 17 powers of your total refractive power of the eye, isn't it? So if you take out the lens, what will happen? The 17 diopters will go, your power will decrease. Okay? Okay? Beta, Dr. Aishwarya, see now, देखो simple है. If lens is like that and you have zonules attached, suppose if these are the zonules, if this gets shrunken, what will happen to the zonules? What if this gets shrunken? What will happen? The zonules will not remain taut, now they will become lax. No? Think about it. Yes, definitely they will become relaxed. They will become lax rather. Hardly any power will be left. Okay? Chalo, so this is one complication. So guys, the phacolytic glaucoma we'll read when we talk about glaucoma in detail. ये हम कल पढ़ेंगे. How phacolytic glaucoma occurs in Morgagnian cataract. As of now, just learn these two things. Tomorrow we'll come to understand how glaucoma occurs. So there we'll read it. Okay. Now, as of now, what you have to learn, another thing is the picture question here. What is the picture question here? This picture is called as the bag of milk appearance. Okay, please write down bag of milk appearance. What is this bag of milk appearance? I'll just show you. Bag of milk appearance. Guys, have a look here. बहुत ही सुंदर picture है. It's a very beautiful picture. Please, all of you see. This is called as a bag of milk appearance. All of you have a look here. HMSC Morgagnian type. So guys, what is happening here? Please see. Generally, there's a central nucleus. Generally, there's a central nucleus. Hai na? But here, what is happening? This is a complication. In the Morgagnian type of cataract, in this Morgagnian type of cataract, the surrounding cortex, it becomes liquefied. When it becomes liquefied, this is all liquefied. So what will happen? The nucleus which was there in the center will sink down. Isn't it? So this is your bag of milk appearance. Can you all identify? So this black thing is all your nucleus. What is this white thing? This is your cortex, which is now liquefied. So this picture is your bag of milk appearance. Clear? Okay. Bag of milk appearance is clear to all of you? So later on, it can cause a glaucoma. How? I'll tell you tomorrow. So these were the stages, guys. Now let's talk about the symptoms. So who is going to tell me what is the most common symptom of a patient of cataract? What is the most common complaint? Anyone? What is the most common symptom? Loss of vision. Dr. Alex, no. Shrinkage of lens occurs only in sclerotic stage. Shrinkage only occurs in sclerotic stage. Okay? So guys, all of you, never say loss of vision. Loss of vision means there is no perception of light even. Okay? Say a decrease of vision, blurring of vision or a decrease of vision. Okay, beta? Very good. A painless decrease in vision. So is it a progressive decrease or it's just a static? Is it a progressive decrease or what? It's always a gradual, painless, a progressive decrease of vision. Am I clear, friends? This is the complete statement. It's a gradual, it's a painless process, and it's a progressive decrease of vision. Very good. Okay, this is the first or the most important symptom. What else we have read? We have read that there can be problems related to glare, especially in PSCs. What is PSCs? In posterior subcapsular cataracts. ठीक है ना? In posterior subcapsular cataracts. Now what next? Here is the very important question, guys. You may have complaints related to colored halos. What do you mean by colored halos? Patient comes to us saying, doctor, I can see a pattern of rainbow. Do you see rainbows here? It's been raining, but I never saw a rainbow. We don't have rainbows in Delhi. हमारे यहाँ तो रेनबो नहीं होते. फिर कैसे हुआ colored halos? So let me explain you. The colored halos is a phenomenon which occurs because of prismatic effect. It occurs because of prismatic effect. Now, what is this prismatic effect? You must be knowing about prisms, physics, prisms, है ना? So when white light comes through the prism, it is seen as scattered in Vibgyor. Yes or no? है ना? So when white light enters the prism, it splits into 7 colors of Vibgyor. So what happens? Let us see. It occurs typically in stages where you have early cataracts, incipient early cataracts. So incipient early cataracts has water imbibition, and each water droplet act like prism. So when white light goes through it, तो क्या होगा? When white light goes through it, it will split into again 7 colors. This is called as the prismatic effect. It is because water droplet act like prism. समझ आ रहा है? So it is seen only in early cases, in some patients only. ठीक है? When lens starts imbibing water, each water droplet act like prism. So when white light or sunlight comes through it, it is scattered into 7 colors. That is why patient sees or experience a phenomenon of colored halos. Now is it clear, Dr. Shriya? Dr. Shriya, is it clear now? ठीक है बच्चे? चलो, good. So friends, colored halos are not only seen in early cataracts, but you can also see colored halos in angle closure glaucomas. You can also see colored halos in angle closure glaucomas. And you can differentiate the colored halos of cataract from colored halos of glaucoma by a test. And this test is called as Fincham test. Very important question. Very important question, guys. ठीक है? Now, so I'll explain you first and then you finish writing. पहले हम explain करते हैं आपको. देखिए सभी लोग. All of you please have a look here on the figure. Can you see this appliance? This appliance is called as stenopic slit. Okay, what do you call it? It is called as stenopic slit. It is called as stenopic slit. Can you see, all of you appreciate a slit in between the black opaque area? Okay, ये slit है. Now, suppose a patient has an early cataract here and the patient has a glaucoma here. ऐसा नहीं होता वैसे, या तो cataract होगा या glaucoma होगा, है ना? Suppose one eye has a cataract and a patient has a glaucoma. So how will you differentiate? The doctor will ask to see the pattern of colored halos through the slit while the moving slit. So if the patient says that the pattern is intact, if the patient says that the pattern of colored halos remain intact, that means it is glaucoma. Pattern remains the same or the pattern remains intact, it is glaucoma. But if the patient says that the pattern breaks in between, it means it is the colored halos due to cataract. ठीक है? Very very simple to remember by a mnemonic B and C. ठीक है? Simple to remember by a mnemonic B and C. ठीक है? आप याद कर सकते हो B and C. Okay? So if the patient says, doctor, pattern जैसे पहले था अभी भी वैसे ही दिख रहा है, या तो इसका मतलब ग्लोकोमा है, पैटर्न रिमेन्स द सेम, इट डज नॉट ब्रेक इन बिटवीन. Am I clear, friends? So please remember, that is a picture question also. They can ask you simple question. In Fincham test, the colored halos are broken in what? So they are broken in cataract. Simple, broken in cataract. The next differential diagnosis of colored halos is mucopurulent conjunctivitis. The next diagnosis, DD, is mucopurulent conjunctivitis. Okay, please remember this much. Chal. The next problem or the next complaint by a patient of cataract is the second sight. I'll just show you a picture guys and then you can understand it better. ठीक है, पहले हम समझते हैं फिर हम लिखेंगे. Please see all of you. Can you see this man happy and delighted? Can you see this old man? What is happening to him? Why is he delighted? Why is he happy? Without glasses, why is he happy? Can you tell me what has happened to him? So I'll explain. Suppose your grandfather, who is a constant user of near glasses while he see his mobile or while he see his newspaper. Yes, yes, Dr. Vikrant is absolutely right. Dr. Imad is also right. Suppose your grandfather one fine day comes to you and say, यार मुझे तो चश्मे के बिना न्यूज़पेपर पढ़ा जा रहा है, मजे आ गए. Won't he be delighted? होंगे ना, खुश होंगे ना कि अब उन्हें न्यूज़पेपर पढ़ने के लिए या मोबाइल देखने के लिए चश्मा नहीं पहनना पड़ रहा. So won't he be delighted if he does not require his reading glass anymore? Yes, he will be. है ना? So this is not a complaint but a feature in patients of nuclear types of cataract. Okay. So why is this happening? ये थोड़ा सा tricky है. Try to understand guys. All of you try to understand it. This is little tricky. That is why I've written it earlier. Now, understand first. You know myopes. Myopes में क्या होता है? Myopes have the tendency that they can read without glasses. For near, if you are a myope, you can try. For distance, you want a glass, but for near, you can go without glasses also, isn't it? If you happen to be myope, then definitely you can judge that. So nuclear cataract patients have an increase in refractive index. That is why they shift towards myopia. They behave like myopes. And myopes have a property that they can read without their glasses. So the same thing is happening in these old patients. They are very happy. But this is only a honeymoon period for a few months. After a few months, this will all be gone. Okay? So this is a complaint. Yes, Dr. Yogita, Dr. Alex, you all are right. Okay? So you have increased refractive index which was already high. 1.42 था ना पहले, अब 1.45 हो गया. So they behaves like myope. Am I clear? Everyone understood? Please write down. There are 2-3 questions here from this topic. In which cataracts do you have second sight? Why there is a second sight and what exactly is this? No, Dr. Alex. See, Dr. Alex, concepts थोड़े clear करो बेटा. Incipient stage, what we have read is for cortical cataract. This is for nuclear cataract. This is a different type of cataract. Okay. No, Dr. Alex, not during incipient. Incipient stage is typically described for cortical cataracts. ये cataracts अलग behave करते हैं. Nuclear cataracts अलग तरीके से चलते हैं. They behave differently. This is a symptom, not a sign. This is a symptom. Okay. So these are the main symptoms of a patient of cataract. Colored halos पे question है, second sight पे question है, glare पे. There are so many questions on glare. Okay, chalo, good. So friends, you have a patient of cataract. How are you going to manage? How are you going to manage? हाँ जी. Patient आया, आपने क्या surgery कर दी उठा के? कुछ करोगे पहले? Will you do something for the patient? Patient आया, चलो OT table पे surgery कर दो ऐसे? Or you will do something? Definitely will do something. What are those things? A complete ocular checkup. No. See, Dr. Yogita, you know that there's a patient of cataract. So now there's no point of giving glasses. But you make sure that he does not have a high refractive error, isn't it? You make sure that the refractive error is not high and the vision is not corrected only by refractive error. He definitely has a cataract. Okay, Dr. Yogita? Make sure that the patient has a cataract and you are operating him. Okay, so you do a thorough checkup. You check up the IOP also. Pressure bhi check karenge. If the pressure is high, first control the IOP. All right, you should do a retina checkup. Okay, you should do a thorough retina checkup as well. Everything should be checked up because it depends on it, it all creates a prognosis for the patient. Suppose, think about it. They put black glasses after the surgery. Suppose, see, look at this picture, friends. Please see. Suppose you treat the cataract. You have done a good surgery. You have treated a cataract, but you forgot to check the retina earlier, and there was a detachment in the retina. Do you think the patient will get vision? Do you think patient will have a good vision after the surgery? No. So you must check the retina always. Okay. If required, you can do a B scan, ultrasound also. ठीक है? आपने सिर्फ cataract surgery नहीं करना है. You have to treat the patient. You have to give vision to the patient. Okay? So everything should be checked before the surgery. Surgery के बाद करेंगे तो patient मारेगा पकड़ के, है ना? चलो. So friends, the first surgery which we have to read is ICCE. What is ICCE? Intracapsular cataract extraction. Intracapsular cataract extraction. And what is that? This surgery nowadays is obsolete. We are not doing this surgery at all. But I'm just telling you for the sake, because we have to understand the surgery. So देखिए क्या करते थे हम पहले. This is a surgery which is now obsolete. So we used to make a big cut. How much big? 9 o'clock to 3 o'clock at the limbus. Big cut at the limbus. No need to draw diagrams here. You used to enter from this place, and then you used to take out the whole of the lens. So what happens to the vitreous and aqueous, guys? What happens to the aqueous? Whole of the lens used to be taken out of the eye. There is a very bad surgery because you have disturbed the vitreous. Yes or no? Yes, you have disturbed the vitreous. So there will be lot of chances of retinal detachments because you have disturbed the vitreous. So many eyes underwent retinal detachment. This is not a good surgery. This was an obsolete surgery. Nowadays we are hardly doing this surgery. Okay, friends? Because it creates a lot of problems in the posterior segment. So we are hardly doing. So doctors decided that we should not do intracapsular. Let us not take out the whole of the lens. Let us not disturb the vitreous. Understood? So they started extracapsular cataract extraction. समझ आ रहे हैं बच्चे? They started with extracapsular cataract extraction. Now what do you do here? The basic idea is that we are not taking out the whole of the lens. Please see, please see. The basic thing is that only nucleus is removed. Only nucleus is removed. That is the basic idea. Just a second. So here the basic idea is only nucleus is to be removed. We are not removing the whole of the lens. Only nucleus is removed. So I'll just explain you, please see, because only nucleus is removed, so the incision required is smaller, 10 o'clock to 2 o'clock. Incision required is smaller. Now please see all of you again. This time, because we are not removing the whole of the lens, only the nucleus is removed. So what we are doing, we are making the opening in the anterior capsule. So this part of the anterior capsule is first removed, okay? So this is the left out part. You have taken out the nucleus by making an opening in the anterior capsule. You just remove the nucleus. Now suture back the incision and place the intraocular lens also in the eye. This is one of the very important benefits of this surgery, because you have taken out the lens. You have taken out 17 diopters from the total power of 60. Patient will not have a good vision unless until you replace it with something. So you have to also put a intraocular lens in place. Okay, so that is the best part of this surgery, that you are also putting a intraocular lens. Am I clear? Yes, it is the artificial lens, intraocular lens. You have to replace that plus 17 diopters, isn't it? नहीं बेटा, लेंस तो हमने निकाल दिया है ना, डॉक्टर प्रियम. हमने लेंस का बीच का पार्ट निकाल दिया है, क्या बचा है ये? ओनली द कैप्सूल. विच पार्ट ऑफ द कैप्सूल? द पोस्टीरियर कैप्सूल इज रिमेन्ड इंटैक्ट. Okay, you have replaced the central wala lens which was the important part, the refractive part, by an artificial lens. Okay, ये जो रेड रेड चीज है ये क्या बचा है बच्चे? इसको क्या नाम दिया है? What do you call this red thing? ये क्या है? This is called as the capsular bag. You call it the capsular bag. Within this bag you fit the intraocular lens. Now is it clear to everyone? So guys, my question to you, is it a very good surgery? It is in the posterior chamber. The best place is the bag. Okay, Dr. Sudeep? Hanji, my question, is it the very good surgery? Is it a very good surgery? Though it's a good surgery, but better than the last one. It's not a very good surgery. Why? Because we are cutting the cornea and you are closing it with sutures. Nobody wants to make a big cut. Nobody wants to put sutures. Nobody wants sutures in the eye. Okay. Why we don't want the suture? What is the disadvantage of this surgery? It is you introduce lot of astigmatism. So what is astigmatism? मैं कुछ समझाने जा रही हूँ, ध्यान से समझिए. So we have three type of refractive errors. First is myopia, because you have a bigger eye. Second, you have a hypermetropia because you have a smaller eye. Third is astigmatism. Astigmatism occurs because of change in curvature of the cornea. Your cornea changes curvature. Now, suppose your cornea is this and you make a cut or you put a suture or anything on the cornea, it will change the curvature. So when you change the curvature, you give astigmatism to the patient. So after the surgery, patient is not happy. Why? Because he will have to wear glasses. Nobody wants to wear glasses. समझ आ रहा है बच्चे? ये सर्जरी अच्छी है but बहुत अच्छी नहीं है, क्योंकि पेशेंट को सर्जरी के बाद चश्मा पहनना पड़ता है, क्योंकि आपने कॉर्निया को काटा है और सूचर मारा है. अब समझ आया है? So what is our main aim? The main aim is that we want to give the patient the perfect vision. So we want a smaller incision where we need not to put the sutures. Okay. So the next surgery is phacoemulsification. Very good, Dr. Alex. Next surgery is phacoemulsification. Okay, phacoemulsification. Nowadays, this phacoemulsification is the treatment of choice. So what is the advantage? The advantage is it is sutureless surgery. Why sutureless? Because the incision is very, very small. It is a self-sealing incision. 3.2 millimeter होता है कितना है? 3 millimeter is very small. Okay, you don't require any sutures. Because the incision is very small, the astigmatism is also very less. So patient is very happy after the surgery. Okay, you do a surgery, recovery is very quick. भाई आपने आज सर्जरी करी, शाम को पेशेंट को बढ़िया दिखना लग जाता है, तो रिकवरी इज वेरी क्विक. He doesn't need to, to have us to come to us for suture removal. There is no suture requirement. Okay. Now I'll just show you first few steps of the surgery and then we can write something. पहले आप थोड़ा समझने की कोशिश करिए, ठीक है? समझने की कोशिश करेंगे अभी सभी बच्चे. I'll take up questions after we discuss the surgeries. Okay, I'll take up some questions. Now have a look here, everyone. This is the prototype surgery, the ECC, where we have made the big limbal cut and we have taken out the nucleus. We put the lens and then we close. This is your typical ECC. But nowadays we are not doing ECC unless until we don't have the facility. Nowadays what we are doing? A phacoemulsification surgery. So देखिए क्या किया है? So this is the first step where we make a corneal incision which is very small. ठीक है ना? See this incision. This is your clear corneal incision which is very small. It is self-sealing. It is just 3.2 millimeter. ये समझ में आता है? ठीक है? अब आपसे अभी facts पे आऊंगी. Dr. Imad, you have to wait for 5 minutes. Okay? You have to wait for 5 minutes. ठीक है? Now question. Very, very important expected questions. I'll show you two instruments because last year unfortunately they also gave you instruments in the exam. So हम पूरे ऑफ्था में जहां जहां इंस्ट्रूमेंट्स पूछ सकते हैं, I'll tell you. So the first instrument here you can see has a very sharp edge. This instrument is called as keratome. What do you call it? Keratome. ठीक है? Kera means cornea, tome means cut. ठीक है, वेरी गुड डॉक्टर गोयल. दिस इंस्ट्रूमेंट इज कॉल्ड एज केराटोम. केरा मीन्स कॉर्निया, टोम मीन्स कटिंग. सो यू आर कटिंग द कॉर्निया विद द हेल्प ऑफ केराटोम. ठीक है, केराटोम, 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 व्हाटएवर, बट आइडेंटिफिकेशन इज इंपॉर्टेंट. यू हैव अ वेरी शार्प एज. ओके, आगे चलिए. So after you make a cut in the cornea, obviously you have to make a opening in the anterior capsule. So this is your capsular opening. Now, because you have to remove the nucleus, think about it, guys. You have to remove the nucleus, which is almost like 7 to 8 mm. Can you remove that nucleus from a 3 millimeter incision? Absolutely not. आप न्यूक्लियस बाहर तो नहीं निकाल सकते ना 3 millimeter के incision से. So what are you supposed to do? So you will cut the nucleus into smaller fragments. How will you cut? By using the phacoemulsification power. This machine has an ultrasonic power. Okay, so it is used to cut the nucleus and emulsify the nucleus pieces within the eye. हम न्यूक्लियस को बाहर नहीं निकाल रहे, हम उसको छोटे छोटे सेगमेंट्स में करके एक एक को आंख के अंदर ही खा रहे हैं. We are eating each pieces of the nucleus within the eye itself. Can you see all the steps now? समझ में आ रहा है? So afterwards what should you do? You have just the capsular bag inside, which is left clear of the nucleus, and then you will put the lens. अब लेंस कैसे डालोगे? लेंस भी 10 मिलीमीटर का है. How will you put that 10 millimeter lens from a 3 millimeter incision? How will you put? Again, the lens will be a folded lens. Okay, the lens which we use in phacoemulsification surgery is a folded lens. This is called as the injector, and in this cassette, ये कैसेट होती है, इसके अंदर फोल्ड करके लेंस को डालेंगे and then we inject. The moment the lens comes in contact with the posterior capsule, it will unfold itself. Okay, guys, are you able to understand? ठीक है, just have a look at the lens. This artificial lens is also 10 millimeter wide. So you can't put the 10 millimeter lens through a 3 millimeter incision. You have to fold it and then you inject. Clear, friends? Okay. What if it does not unfold? है ऐसे मत बोलो यार डॉक्टर प्रियम, तुम मरवाओगे हमें. अगर लेंस अनफोल्ड ही नहीं हुआ तो मरवाओगे तुम हमको. हाँ, ऐसे नहीं होता बेटा. They are made up of such beautiful material that they have to unfold. They have to be unfold. नहीं, they will unfold. And then we have some manipulators. See, we have some instruments by which we help the lens to unfold. Okay, ऐसे नहीं होता. They will unfold. चलो. So I think the basic phacoemulsification वाला चीज is okay. Now my next question, something about this. देखिए इधर. So this is the next surgery, guys. Though it was started before phacoemulsification, but I teach you after phaco. So this is called as a small. We will write. Don't worry. We will write. Don't worry, guys. But this is a picture question. Okay. So transition from ECC to phaco is through SICS. This is a transitional surgery. Those who cannot do phacoemulsification or those who do not have facility and they don't want to do ECC, they don't want to put sutures, they don't want to cut cornea, this is a very good surgery. So what we are doing, we are taking out the whole of the nucleus but not through the cornea, because when I cut the cornea I get astigmatism. Yes, so here I am cutting the sclera. Can you see what shape of incision I am putting at sclera? It is a frown shaped incision. Frown shaped incision. ठीक है, smile or frown you can say. Now I dissect the sclera. So this dissection has to be a blunt instrument, yes or no? It shouldn't be with sharp, otherwise वो काट ही देगा. मुझे तो dissection करना है, तो मैं dissection कैसे करूंगी? मैं dissection करूंगी something which is not very sharp. Okay, so this instrument is called as a crescent knife. ठीक है, अब मैंने एक tunnel बना ली and I entered the cornea. So what will happen? I'll create a plane. without cutting my cornea. So what is the advantage of this surgery, guys? The advantage of this surgery is that the astigmatism is very less. Okay, so you all can write down, or you all can write down, the fourth surgery is SICS, small incision cataract surgery. Small incision cataract surgery. So we create a frown shape incision at sclera. Frown incision at sclera. Tunnel, a sclerocorneal tunnel is made. A sclerocorneal tunnel is made. Okay? Is that clear to you, friends? और कौन से इंस्ट्रूमेंट से बनता है? This is important. The name of the instrument is a crescent knife. A crescent knife. Please write down. Crescent knife. ठीक है? And this is also a picture question. They'll show you a small incision cataract surgery. They can ask you which procedure is this? And what is the advantage? Less astigmatism. But if they ask you which is better, this one or phaco, obviously you have to say phaco. Phaco is the treatment of choice. Done with it, friends? Are you able to understand what is SICS? पिक्चर समझ में आ जाएगी सबको स्मॉल इंसिजन कैटरेक्ट सर्जरी का? हाँ जी डॉक्टर ऐश्वर्या, आई एम कमिंग टू इट, गिव मी जस्ट फ्यू सेकेंड्स. स्मॉल इंसिजन का पिक्चर क्लियर है सबको? ठीक है, आई शो यू क्रीसेंट नाइफ वन मोर टाइम. नाउ Dr. Aishwarya is asking us, guys, what about astigmatism in phaco? So yes, when we are cutting the cornea, no matter how smaller is the incision, you are definitely giving astigmatism. Though phaco is a very good surgery, but still it is not the best because you are cutting the cornea. So what we are doing? We are giving nowadays the cosmetic look to the patient, है ना? Vision तो है ही है, but patient कहता है मैं तो चश्मा बिल्कुल नहीं पहनूंगा, है ना? I don't want a little bit of speculum. I want a perfect vision. So for that we have femto laser assisted cataract surgery. ठीक है? Femto laser assisted cataract surgery. This surgery is also called as robotic surgery. Isn't this a fancy thing? A cataract surgery by a robo. Actually, this is not the robo. This is basically your what? This is basically your laser surgery by femto laser. So this femto laser is actually a ND glass laser. When you get a surgery done by laser, it gives more precision to the surgery. ठीक है? It is more precise. लेजर से हम आधे स्टेप्स कर रहे हैं सर्जरी के. It is more precise. It gives better results. But it's a very costly affair, so we are not doing it day and out. It's a costly affair. ठीक है? Now questions. The word femto laser means that it works on a very high frequency and a very specific frequency part, that is 10 raised to the power minus 15. Femto का मतलब क्या है? 10 to the power minus 15. It has a wavelength of 1054 nanometers. All these are questions. ठीक है? And this is also a picture question. See, phaco is more than everybody wants to do phaco. Dr. Waghela, everybody wants to do phaco, but in peripheries where the machine is not available, because in machine का अपना बड़ा cost होता है. So there people are doing more in camps, small incision surgery. ठीक है? It's a very quick surgery because you don't have to put sutures. All right. Now there's a picture question also on flax. Now I'll come back. Huh. Dr. Shreya and everyone, you can see this picture and understand. In phacoemulsification, we are definitely giving some amount of astigmatism because we are cutting the cornea, though it's a very good surgery. But when we do surgery by a laser, few steps are done by the laser, then you are very happy because you are getting operated by a laser. Which laser? A robo. This is your femto laser. ठीक है? ये femto laser में क्या हो रहा है? Can you see in the first figure? दिस इज द लेजर सेटिंग्स व्हाट वी आर डूइंग. ये लेजर का सेटिंग कर रहे हैं हम. ठीक है. तो कुछ स्टेप सर्जरी के लेजर करता है, जैसे कि कटिंग, wherever cutting is required it will be done by the femto laser. So suppose मेरे को incision बनाना है. If I make an incision, that can be a ragged incision, yes or no. But if a laser makes that incision, it will be a perfect incision, yes or no. It gives you a precise cutting, yes. It gives you every step very precise. ठीक है. Disadvantage of SICS, again some amount of astigmatism. It's a very manipulative surgery. You manipulate the iris. इसमें ज़्यादा manipulation नहीं होता ना. Phacoemulsification has very less manipulation of the rest of the structures. SICS causes a lot of manipulation, a lot of bleeding through the sclera. आप sclera को काटते हो ना, there's a lot of bleeding. ठीक है. Chalo. So let us now see one picture question. It is about the crescent knife. Where are we using this crescent knife? Please see. This is called as the crescent knife. Where are we using? This is for creating a tunnel. Can you see the difference here? This has a very blunt edge. It's a tongue shape. Has a tongue shape edge. Not very sharp. It is mainly used for the dissection purposes. ठीक है बच्चे? यहाँ सबको clear हो रहा है? All the pictures are clear to you, friends? क्लियर. कोई डाउट, कोई स्टूपिड डाउट भी किसी को पूछना है तो पूछ सकते हो. एनी काइंड ऑफ डाउट, एनीथिंग व्हिच यू हैवंट अंडरस्टूड. So we'll take a short, discontinuation, because we will be going back to see our questions. Then we'll talk about another topic on complications of the surgery. ठीक है, पहले हम questions पढ़ते हैं. चलो friends, let's talk about the questions, and this is our first one here. हाँ जी, read this question well, all of you. फ्लैक्स का मशीन कितने का आता पता नहीं यार, बहुत महंगा. It's like many crores. See, a simple phaco machine is around, simple one, it's around 10 lakh. A good phaco machine will be around 25 lakhs. Haan. Very good, all of you are correct. So we are talking here about the second site. This is typical complaint of second site, typical. And this you see in nuclear cataracts or nuclear sclerosis. Very good. I'm glad that you all are answering very well. ठीक है. चलो ये बताइए बच्चे. ये भी ऐसे सही बता दो. Good. All the following associations are true except, which is not correct. So quick. Very good. Because in galactosemia you have a oil droplet type of cataract. Please remember, this is very, very important. Where do you have glaucoma flecken? So very important expected question. Where you have glaucoma flecken? It is angle closure glaucoma. Okay, good. ये बताइए, a repeat, a old question. So ये old repeated question. Only reversible cataract. So it is your cataract in galactosemia. What is the name? It's again your oil droplet cataract. ठीक है? Good. Oil droplet cataract. Very good. चलो ये देखो, a very important question. See if you can answer. It's a little tricky one, which is not correct. Make sure that you have read the word not correct. Make sure that you have read. Good, Dr. Ronak. Very good. Very impressive. Impressive it is. बाकी सब तो बता रहे हैं बाद में, but it's very impressive if you know. So let us see how he and everybody reached to the answer. Now 35-year-old patient में आपको cataract होता है? 35-year-old patient में cataract? Yes, it can happen because he has a history of childhood asthma. So guys, if there's a childhood asthma, what can happen? What can happen? He must have used drugs. Which drugs? Steroids. He might have used steroids here, isn't it? So if he has used steroids, what kind of cataract he may have? What kind of cataract he may have? He may have a posterior subcapsular cataract. Yes or no? Because this is a typical complaint of glare. We are showing you a glare. So glare means a posterior subcapsular cataract. Okay? Please remember, steroid induced cataract is also a posterior subcapsular cataract. Okay? So please remember, if you have not written, glare, posterior subcapsular cataract, even steroids induced cataracts are posterior subcapsular cataracts. Okay? Now guys, please write down something. Please write down something. Steroids can cause three types of problems in the eye. What? Anyone? It can cause a posterior subcapsular cataract. It can cause a glaucoma, and it also can cause a central serous retinopathy. Okay, so there can be three types of problems with steroids. Please write down. You can also have a glaucoma with steroids. Okay? So in the question, we have a patient, a young patient who has asthma since childhood. So he must have taken steroids. Okay, so here he can have a PSC. I'm sure everybody understood that. बहुत बढ़िया, बहुत अच्छा बताया, good, impressive. चलिए ये देखिए, let's see if you can answer. Last point is central serous retinopathy. Dr. Sunil will read this maybe tomorrow when we talk about retina. Okay, it will be discussed in retina. मुझे पता था डॉक्टर इमाद डी बोलेंगे, है ना? But this is not the answer. See, flax is not the best surgical option for cataract, especially for this patient. Why not? Acha chalo, let us solve this. This is a picture of HMSC Morganian type. Yes or no? You know this is a patient of Morganian cataract. ठीक है? अब हुआ क्या? Do you think a cataract patient comes with a sudden painful red eye with a headache? First tell me this. Do you think a patient of cataract comes to you with a pain, red, sudden decrease in vision? So what is it actually? This is actually a complication. He has developed a glaucoma as a complication because earlier he had a gradual decrease in vision. So he had a cataract. Now he had become 75. 75 का बुढ़ा हो गया है ना? उसने ऑपरेशन नहीं कराया है. He hasn't undergone surgery in time. He's very old now. Now he has developed a complication. What is that complication? A phacolytic glaucoma. No, beta, this is not glaucoma flecken. No, no, no. डॉक्टर मोहम्मद ध्यान से देखो बच्चे, सुनो. ग्लॉकोम फ्लेकन क्या था? ग्लॉकोम फ्लेकन इज अ कैटरैक्ट आफ्टर ग्लॉकोमा. We are saying it is a glaucoma after a cataract. Okay. So there is a complication which has occurred because of hypermature Morganian cataract. Yes, Dr. Rahul is absolutely right. So now this patient has developed a glaucoma because of HMSC Morganian cataract. Okay? So how will you control? How will you treat? So you must do a urgent cataract surgery, but unless until you control the IOP first. First control the IOP. Okay na? First control the IOP, decrease the glaucoma, decrease the pressure, and then you do a cataract surgery. Am I clear, everyone? Am I clear? So this is your correct answer. Okay? Never do a cataract surgery if your patient is coming to you with a high pressure. What will happen? अगर आप इस high pressure में काटोगे तो क्या होगा? सारा सामान बाहर आ जाएगा आँख का. You can't cut. You can't cut. Okay? Every time if your pressure is high, you must decrease the pressure. The moment you make a small cut, all the contents will come out of the eye. ठीक है? It will be a lot of complication. बहुत जबरदस्त complication होती है यार. तुम हंस रहे हो डॉक्टर आदित्य? चलो ये बताओ. Okay, you see it's a traumatic cataract. It's a rosette shaped cataract. ठीक है? Very simple it is. चलिए ये बताइए. So now let's talk about हाँ जी. Chalo friends. Now let's talk about some complications of cataract surgery. This is another very important topic. Okay? Some complications of cataract surgery. So we have to write down many, but we have to read in detail only two. Okay? So the first complication of cataract surgery is edema in the cornea. Cornea becomes edematous. Next is hyphema. What is hyphema? Blood in anterior chamber. Blood in anterior chamber. You manipulate the iris, you touch the iris, so there can be bleeding in iris. Okay, there can be bleeding in anterior chamber. You call it hyphema. The next very important is uveitis or inflammation. Whenever you do a surgery, there can be uveitis. Next is a high IOP. Pressure can become high after the surgery. Next important one is endophthalmitis. Endophthalmitis, inflammation of inner contents of the eye. Next, very important is PCO. Next important complication is cystoid macular edema. So just write down, enumerate the names here, and we'll discuss the two in detail. We'll discuss these two in detail. ठीक है बच्चे, ये हमें, हाँ जी, Dr. Imad, yes, we are talking something about endophthalmitis which has a hypopyon also. Which has a hypopyon also. Okay, I hope you have all written here. Endophthalmitis को समझते हैं, ठीक है? So guys, what has happened? There is itis. Itis मतलब क्या होता है? What do you mean by the word itis? Itis means an inflammation. There is a very severe inflammation. There is a very severe inflammation of what? Of inner contents of the eye, except the sclera. So what is spared in endophthalmitis? Your outer content or outer coat is spared. So what is spared? Sclera is spared. ठीक है बच्चे? End of मतलब क्या हुआ? अंदर का सामान. End of. Your inner contents of eyeball is severely inflamed. It's a very severe inflammation of inner content. What is not affected, what is not inflamed is your outer coat, which is sclera. ठीक है? अब होता क्या है देखेंगे. So there is a serious infection by mainly the staph epidermidis. Mostly in the early cases, you can even have this infection which may be caused either by a fungus or by propionibacterium acne. All these questions have already been asked to you. There is a severe inflammation by either of these organisms. If it is occurring in early phase, early as in 1 to 2 days after the surgery, that means it is by staph epidermidis. What do you call staph epidermidis as? A coagulase negative staph. Yes or no? We can also call it a coagulase negative staph. Okay? In late cases, it may be either by a fungus or by a P. acne, propionibacterium acne. ठीक है? अब होता क्या है patient को? What is the presentation of the patient? So he comes to you with complaints of PVR. What is PVR? Pain, decrease in vision, and a red eye. These are your PVR symptoms. Very important, guys. आप कैटरेक्ट सर्जरी करते हो, आप क्या एक्सपेक्ट करते हो? व्हाट डू यू एक्सपेक्ट आफ्टर कैटरेक्ट सर्जरी? पेशेंट हैज अ गुड लाइफ विद अ वेरी गुड विजन, yes or no? But if a patient is coming to you with PVR, your heart will sink down, है ना? कि क्या हो गया? आफ्टर कैटरेक्ट सर्जरी पेन तो होना ही नहीं चाहिए, रेड आई क्यों हो गई, लॉस ऑफ विजन क्यों हो गया? So this is because the patient has developed a dreadful complication. It is endophthalmitis. Okay. Now, when I see the patient, I'll see certain signs. First of all, my decrease in vision बचे. vision, decrease vision. Okay. First of all, my cornea is edematous. My cornea is not clear. है ना? There's a lot of edema in the cornea. Cornea is not clear. What else? You have lot of inflammation in anterior chamber and vitreous. Both of them are very inflamed. There is reaction in anterior chamber. There is reaction in vitreous as well. Okay? Now, very important sign is a hypopion. What is hypopion? Hypopion is nothing but the pus in the anterior chamber, and this is also a picture question. Okay, you see a pus in the anterior chamber. Okay, friends, it is a picture question, hypopion. Now, guys, have a look here, and you have to answer me. ठीक है? आपकी पूरी eyeball inflamed except for sclera. So your, main inflammation is in the vitreous. Okay, you have a hypopion here, settle down in the anterior chamber. This is your pus in the anterior chamber. So obviously there's a staph. How do you treat it? Think about it and tell me, what would you like to give? What would you like to give? You will be giving antibiotics. Very good. Which type of antibiotics? I want the treatment directly to be given here. So which type of antibiotics would you like to give? डॉक्टर रौनक स्टेरॉइड्स मत बोलो क्योंकि बहुत तगड़ा स्टैफ का इन्फ्लेमेशन है ना. सो व्हाट विल, वेरी गुड, वेरी गुड. डॉक्टर कौर, इट्स नॉट आईवी, इट इज इंट्राविट्रियल. I want to give antibiotics, but I would like to give this in the form of intravitreal injection. Directly the drug will go into the vitreous cavity. ठीक है, ध्यान से समझेंगे. If your problem is in the posterior segment, the drops will not be able to go. Drops do not have a good penetration for posterior segment. ठीक है, आप जब आई ड्रॉप्स देते हो तो वो सिर्फ एंटीरियर सेगमेंट में काम करती है. ओके, ड्रॉप्स डू नॉट गो nicely in the posterior segment. What else? Even your systemic antibiotics, like if you go give oral or if you give IV, intravenous, as Dr. Kaur has said. अच्छा नहीं, आपने भी विट्रिल कहा था. ठीक है. So जैसा कि मैं कह रही हूँ कि इंट्रावीनस एंटीबायोटिक्स नहीं देंगे. क्यों? अगेन द पुअर बायोअवेलेबिलिटी. Okay, so it is said that there is no role of systemic antibiotics. This is your treatment of choice. ठीक है, definitely we can give vancomycin, definitely, but please write down, there is no role of systemic antibiotics. It is a very important statement. Systemic antibiotics do not penetrate easily. Guys, this is a ocular emergency. If the patient is not treated well by intravitreal antibiotics, then you don't waste time. You do a surgery. You do a surgery in the vitreous cavity, vitrectomy. And what is the name of the surgery here? Again, this surgery will be done by the pars plana route. We call it pars plana vitrectomy. ठीक है बच्चे? Okay? We go inside the vitreous cavity, cut the vitreous, and whatever microorganisms are there, you just clear the bacterial load, and then you can also give antibiotics. Okay? So please remember, the treatment of choice is intravitreal antibiotics. If not treated, then you do a surgery. Clear hai sabko? I'll show you some pictures also, but how to diagnose this endophthalmitis. ठीक है बच्चे, देखिए इस पेशेंट को एंड सी दिस पिक्चर ऑल्सो. हाँ जी, सी ऑल ऑफ यू, दिस इज अ टिपिकल हाइपोपियन है ना. इट्स अ टिपिकल हाइपोपियन. कैन यू ऑल सी? Can you all see hypopion? Yes. This arrow mark is your hypopion. This is again a slit lamp picture. This is again a slit lamp picture. ठीक है? Yes, pass in the anterior chamber. Dr. Imad, if you have a late endophthalmitis, first of all diagnose either it's a fungal infection or a P. acne infection. most of late cases do not respond much to intravitreal antibiotics, most of them. But we definitely try first with again intravitreal antibiotics, and if it is a fungal, give antifungal agent as well with the same route. If not treated, do a surgery, pars plana vitrectomy. The same type of management is there. ठीक है बेटा? Okay, now see this patient. See this patient. He is an old man. He is a 65-year-old man. Diagnosis is mainly clinical. If you are in doubt, you can do ultrasound. If you are in doubt, you can do ultrasound. You will see vitreous inflammation, and then you can call it a endophthalmitis. Mainly, it is a clinical diagnosis. If a patient comes to you with pain, decrease in vision, and redness after surgery, think about endophthalmitis. ठीक है? Okay, Dr. Priya. चलो इस बाबा को देखो. So this old man. Now he was very happily operated and he remained happier after cataract surgery for 1.5 years. But now he is coming to me with the same complaint. So he says, Doctor, you've done a great job, but now since few months, I'm again having a gradual, progressive, painless decrease in vision. So is it again a cataract? What will be your answer? Is it again a cataract? Is it again a cataract? No, never. Once you have taken out the lens, the cataract cannot come up again. So what is it? What is it? This is a complication which we call as a PCO. ठीक है? अब बात करते हैं second complication की. This is called as a PCO. Please write down PCO. It is also called as after cataract. It can also be called as a secondary cataract. Please remember the names. ठीक है? But the true name is a posterior capsular opacification. ठीक है? The true name is posterior capsular opacification. It has 3 names. Now होता क्या है? So what is the complaint of the patient? Same as that of cataract surgery. A gradual, a painless decrease of vision. ठीक है? A gradual, painless decrease of vision after cataract surgery. So it is mainly a late complication of cataract surgery. ठीक है? It's mainly a late complication. Patient was happy. ठीक है? Now there are actually mainly 2 types of PCOs. The first is in the form of a ring. We call it a Sommering ring. क्या नाम दिया है हमने? It is like a ring. Sommering ring. The next is in the form of a pearl. We call it Elshning pearl. So it's all about jewelry, ring and pearls. Which one do you like, girls? Which one do you like more, pearl or ring? So pearl is a more common type. Okay? Pearl is a more common type. They can ask you. I'll show you pictures also. These are also your picture questions, friends. आप समझेंगे हो क्या रहा है? Why is this happening? Why is such complication happening? Let us understand through a diagram. पहले सभी लोग देखिए. All of you, I want all of you please see here. So this is the end stage here, है ना? You have left the patient like that. Now your posterior capsule, which was clear, gradually this posterior capsule develops small opacification area. So when this becomes opacified, obviously the vision will decrease. Yes or no? Yes or no? So the patient will not have a clear crystal vision. So what will you do? Because you have to treat the patient, you will make a hole in the central part of the capsule. And what will you call it? You will call it a posterior capsulotomy. ठीक है? आप लेजर से यहाँ पे एक छोटी सी ओपनिंग बना दोगे. You will create a opening so that whenever light is entering, light can go without the deviation, without the scatter or without stopping. सही है? So the treatment here will be by a Nd:YAG laser posterior capsulotomy. हाँ जी. Am I clear to all of you? Nd:YAG laser posterior capsulotomy. Done? Yes guys, any problem? No Dr. Priyam, this is definitely not an infection. No, 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 this is not same laser of flax. Dr. Imad, see, that was ND glass. This is ND YAG. Okay, what is ND YAG? Neodymium, yttrium, aluminum, garnet. And the wavelength here is 1064. That was 1053, है ना? That was 1053 nanometers and this is 1064. ND glass जो था वो 1053 था और ND YAG क्या है? 1064. Okay. Now have a look at the picture so that you have a better idea. Please all of you see. So this is the picture of Elshning pearl. Can you see the posterior capsule has small pearls here? ठीक है, अब पेशेंट को ऐसा हो जाएगा तो क्लियर नहीं होगी ना विजन. It should remain transparent. Similarly, this is a PCO. Can you see this has all become fibrous, white. So what will you do? This is your ring form. This is the ring form. Okay, ring बन गई ना ring. अब इसको ट्रीट कैसे करेंगे? If you make a central opening, please see, this is a picture question again. This is your laser central opening. If you create this opening with the help of a laser, what will happen? The light will go clearly. ठीक है ना, कुछ भी नहीं होगा, लाइट क्लियरली चली जाएगी, ऑब्स्ट्रक्शन नहीं हो रही. ठीक है, आपने लेजर से बीच में एक छेद मार दिया है. These lasers are very precise. They will not damage the surrounding areas. Don't bother about the lens and all that. ठीक है. हाँ जी डॉक्टर गौतम, इज इट ओके? डॉक्टर सेंथिल, see, your pupil is not dilated all the time. Your pupil is normally 2 to 4 mm. So that is the opening which we create, 2 to 4 mm opening. Yes, okay Dr. Vikrant. Dr. Vikas, yes, what do you want today? Please teach with basic, take all queries at end, please. अच्छा डॉक्टर विकास, don't mind it. Don't you think that their queries may also be your queries? No. if everybody thinks like that, we can take the queries at the end, no problems. ठीक है. Posterior polar cataract, beta, it's a very dense cataract. We can't, that is a cataract. Your laser is not going to dissolve that cataract. Okay. These lasers do not have so much of power that they can make an opening in the posterior polar cataract also. Okay. Okay, Dr. Ishwarya. क्या बेटा बता, आपको क्या समझ में नहीं आ रहा, आप पूछो ना. डॉक्टर विकास, you can ask me your doubt, whatever you have not understood, you ask me. डॉक्टर विकास, आपको क्या समझ में नहीं आया, आप पूछो. You can write down. Please write down what is your doubt, बच्चे. So I can say, Dr. Vikas, whatever your problems are, like your fellow friends are asking, you can also. हाँ, कोई बात नहीं. देखो, सभी बच्चे आपके जैसे हैं डॉक्टर विकास, जैसे आप हो आपके जैसे ही हैं सभी बच्चे. ठीक है, आप बिल्कुल नहीं सोचो कि मुझे कुछ नहीं आता है, आपको नहीं आता है, किसी को भी कुछ नहीं आता है. ऐसे क्यों सोच रहे हो कि सब आपसे ज्यादा पढ़े लिखे हैं? ऐसा कुछ नहीं है बच्चे. सब आपके साथ ही बैठे हैं, आपके साथ ही क्लास अटेंड करें. दे आर गोइंग टू गिव एग्जाम विद यू ओनली. ओके, don't worry, don't bother. See, Dr. Deepu, the hypopyon is basically pus in the anterior chamber. We definitely give drops also, but the treatment of choice is intravitreal antibiotics. Together with that, we give topical antibiotics also. Okay. Chalo, let's stop this discussion. Dr. Vikas will focus more, and if he has or anybody has any kind of problem, please you can write down in the chat box. I'm here to explain you only. Okay. चलो, मैं बीच में थोड़ा हिंदी और बोलती हूँ डॉक्टर विकास, शायद आपको तब समझ में आएगा. ओके, चलो, बिल्कुल कोई परेशान नहीं हो ना, आराम से लिखो, आराम से बनाओ. ये देखो ये क्या है. Let us talk about the next topic now. Complications are over. This is the next topic. Next topic, subluxation. So can all of you see the lens here? What is happening with the lens? What is the problem here? Can all of you see? What is the problem? Lens is not dropping, bache. Lens is actually going up and out. Can you see? Can you see? Yes, lens is displaced. So I am just shading everything in play pink color. ये आपका लेंस है जो ऊपर भाग गया है. ऊपर भाग गया है, ऊपर. लेंस ऊपर चला गया, ऐसे हो गया. Subluxate. Lens is displaced up and out. Now when I magnify this, you will see something like that. Please, all of you have a look. This is typical of Marfan syndrome where your lens goes up and out, up and out. ठीक है. अब कैसे गया डॉक्टर तनिषा? देखिए. So you know that zonules are holding the lens in place. If lens is going up, that means the zonules are here weak. Zonules here are weak. Yes or no? That's why the weak zonules are not able to hold the lens in place. Good zonules are pulling it up. Okay. Now it can happen. It's not relaxed. It's weak. It's weak. Dr. Mohammed, it's weak. So one is trauma, that if you have a trauma, there's a zonules got broken and then lens goes up and out or anywhere. It's mainly because of the trauma. But there are 4 conditions which you have to learn and mug up properly after understanding, because this question has been there in your exam many times. Okay, please write down. So what is subluxation of lens? What is subluxation? And what is dislocation? So dislocation is complete displacement. It is a partial displacement, and this is complete displacement from its place. Okay? Now there can be so many causes. Not hyperfunctional. One is normal and other is weak. Not hyperfunction. Okay? This is also called as ectopia lentis. Ectopia means it's not in the place. This is also called as ectopia lentis. It is also called as ectopia lentis. Now, what are the causes? First is obviously trauma. It can be familial. It can be seen in families. Okay? Otherwise, it can be seen in cases of Marfan syndrome. Very important question. And in Marfan syndrome, the typical subluxation occurs in the supratemporal quadrant. बहुत easy है. Supratemporal quadrant. Now, after Marfan syndrome, you have to learn that it is seen in homocystinuria. Homocystinuria. And in homocystinuria, where will the lens go? Opposite. Infranasal. So look at me. Marfan's में lens will go like that. Homocystinuria में इधर नीचे and down. Infro and nasal. Infro and nasal. Okay. Now what about the next one? The next is very important. It is Weil-Marchesani syndrome. Weil-Marchesani syndrome. And in Weil-Marchesani syndrome, the lens will go where? It will go forward. Forward मतलब कहाँ? Forward where? Forward in anterior chamber. Forward in anterior chamber. Okay? It's very simple to learn. Fan. What do you understand by the word fan? फैन ऊपर होता है ना, ऊपर पंखा चलता है. So fan is supra. ठीक है. What about march? The word march. March means you march forward. So this is how you can remember. March is forward. Okay, march is forward. And there are so many other causes also, but please remember at least this much. Okay, please remember at least this much. This was the question in your 2019 exam. In homocystinuria, where do you see? It is in infranasal side in homocystinuria. Okay? बहुत सारे और भी हैं, बहुत सारे हैं, लाइक Ehlers-Danlos syndrome, there are so many. ठीक है, इसमें भी दिखती है. Okay guys, so will you be able to identify a patient who has a subluxated lens? This is a picture question. आपको देखना है कि लेंस ऐसे है या ऐसे है. Easy है, बहुत easy है. Now the next and the last topic is a congenital cataract. ठीक है, congenital cataract. Congenital cataract. So congenital cataracts, the first thing which we have to know is about two questions. Question number one is, what is or what is the most common type of congenital cataract? Okay, Dr. Vikas, now is it clear? ये समझ में आता है सब कुछ? Have you understood the topic of subluxation, Dr. Vikas? See, if the subluxation, Dr. Priyam, if the subluxation is associated with a decrease in vision or a cataract, then you have to do a cataract surgery. Very carefully, you will be doing phacoemulsification. It's a very careful, careful procedure. But if there's a subluxation, it may remain there for life without any visual disturbance also. Then you need not to do anything. Okay. The first question is blue dot cataract. जो डॉक्टर इमाम ने बिल्कुल ठीक बताया, it's a blue dot cataract. The meaning of the word blue dot is that within your lens, you see few blue dots. Okay, within your lens, you will see certain blue, small blue dots. Now, this blue dot cataract, though it is a cataract, but vision remains normal. And it is said that this cataract is mostly a universal cataract. Universal means that more than 90% of population has it. 90% of the population has it. So maybe even I may have a blue dot, even you may have a blue dot, yes or no? Almost 90% of the population has a blue dot cataract. But do we have a decrease in vision? No, vision remains normal. So here comes the second question. The second question says that what is the most common congenital cataract? What is the most common congenital cataract with decrease in vision? With decrease in vision. And here the answer is a lamellar cataract. Lamellar cataract is same as the zonular cataract. Okay, both of them are same. A lamellar and a zonular cataract both are same. दोनों का एक ही मतलब है, lamellar or a zonular cataract. Now there are a few more questions associated with this cataract. These type of cataracts are associated. These type of cataracts are associated with maternal rubella. So if the pregnant female develops rubella, the baby can have a lamellar cataract. Or it is associated with maternal vitamin D deficiency. Vitamin D deficiency. Very good. This is a cataract which is associated with riders also. Riders. When the patient has a rider, it gives rise to a spoke of wheel appearance. And sometimes it is autosomal dominantly inherited. It can run in families as autosomal dominant thing. Okay. Rider का क्या मतलब है? It gives rise to a spoke of wheel appearance. Spoke of wheel appearance. Okay, it is a question. Spoke of wheel. Ectopia lentis includes subluxation and dislocation both. Dr. Kaur, both. So now I'll be showing you a picture which shows riders and be coming, beta, coming. Wait for a few seconds, wait. Now all of you have a look here. So the first one is a blue dot cataract. Your lens has small blue scattered dots, है ना? But this type of cataract does not have a decrease in vision. Now have a look at this. Lamellar or a zonular cataract means only that particular zone of lens will be opacified, which is being affected at the time of development. Rest everything will be clear. So आप ये देख रहे हो ये एरिया, ये तो बिल्कुल clear है. This is all clear. This has the opacification, isn't it? Can you see this spoke of wheel appearance, something coming out here? This is called as a rider. Okay, I have one more picture, I'll just show you. So this is again your zonular cataract with riders. Okay बच्चे, ये जो बाहर आ रहे हैं ना ऐसे, this is your spoke of wheel appearance. All right, ठीक है? Now my next question is how the mother comes to you. Mother क्या complaint लेके आएगी? क्या बोलेगी मदर आकर? मदर आकर ये बोलेगी डॉक्टर साहब मेरे बच्चे को कॉन्जेनाइटल कैटरेक्ट हो गया है. व्हाट विल शी से? व्हाट विल शी से कि मेरे बच्चे को कॉन्जेनाइटल कैटरेक्ट है? No, she will say that the baby has a leukocoria. What is leukocoria? This is also a picture question, friends. No, not see baby hai. How will the mother come to know the baby has a loss of vision? The mother will come to you complaining, doctor, my baby, my small baby which is still in the lap, congenital cataract hai na, the baby shows abnormal white pupillary reflex. This is called as leukocoria. Not teary eyes, Dr. Priyanka, no, a white pupillary reflex. The word leuc means white, the word coria means pupil. So what is it? It is abnormal, please write down, abnormal white pupillary reflex. ठीक है? डॉक्टर को बोलेगी डॉक्टर मुझे बेबी की आंख में कुछ व्हाइट व्हाइट दिखाई देता है, अजीब सा व्हाइट दिखाई देता है. So this is called as leukocoria. Okay, and how will you treat this? Again you have to do a surgery. What is the surgery? Again a phaco surgery you will be doing, and this time the surgery, please write down, this is an important question, the surgery will be done as soon as possible. Okay, so please write down, the treatment will be again a surgery, and surgery will be done as soon as possible. I'll explain you later why as soon as possible. You just have to write down today, to prevent amblyopia. To prevent amblyopia. ठीक है भाई? And this is a picture question, guys. I'm sure आपको कुछ अलग white दिखाई दे रहा है ना? Right eye में you can see something abnormally white. That is the abnormal pupillary reflex because the baby has a cataract. So you have to remove again the cataract. How? You do a surgery. Again the same cataract surgery, but this time leukocoria, abnormal white pupillary reflex. Abnormal white pupillary reflex. Okay? ठीक है? Because it is a reflex only ना. See pupil को तो क्या हुआ है? Pupil तो normal ही है बच्चे. Dr. Vikrant, pupil is normal. It is a reflex which we see in the pupil because of the white lens. That is why we say it a abnormal white pupillary reflex. Dr. Shriya, I told you, ये मैं आपको next squint में समझाऊंगी what is amblyopia. As of now, just write down to prevent amblyopia. To prevent amblyopia. ठीक है? So I think we are about to end. I think we'll take a lunch break and then we'll come back in half an hour. ठीक है? 35. हाँ, we'll take a 30-minute break and then we'll come back. We'll do some questions also. हाँ जी, if you have any kind of problem, please write to me, guys. कुछ भी समझ में नहीं आया है या फिर आपको लग रहा है if anything needs to be changed, please let me tell. ठीक है? Let me do 30. We'll start at 2:30. 2:30. The images will be shared with you, Dr. Shubham. Don't worry, the images will be shared with you. Don't worry. Okay. अच्छा ठीक है, we'll start at 2:30. Okay, don't worry, we'll start at 2:30. Okay. चलो, whatever problems. See, Dr. Teresa, ectopia lentis is same as subluxation or dislocated lens. This is a medical term. Ectopia means not in the place. Lentis means lens. Chalo, so let us take a break, guys. Come back in almost 35 minutes.